tired. I just want to go to sleep.
Okay, let's take you home.
Hi, what brings you in today?
Hi, doctor. I noticed that lately my son is having a really hard time running around and he seems to fall very often.
How long has this been going on for?
Lately I've just been seeing him struggle to move around on his own. Like, I don't really know how long it's been going on. Maybe I missed some signs because I've been so busy working and not able to spend as much time with him as I wanted to. But he was born a healthy baby and he came out right around his due date. I mean, he had a bit of a speech delay, and he took a lot of naps when he was younger, but I thought that he was just a little bit tired, and I didn't really think much of it when he didn't play as much with the other kids. And now that I think about it, I always thought he was a little clumsy, but other than that, I think he's been growing up fine.
I see. Do you have any history of genetic diseases in the family?
Not that I know of. I don't think so.
Okay. Billy, can you try walking for me? Thank you. Okay. So notice how Billy's putting weight on his arms in order to stand up. That's called Gower's sign, and it's where the patient puts weight on his arms in order to get up. This is an indication of muscle weakness. I have a feeling that the disease could be DMD, which is Duchenne muscular dystrophy. We'll have to run a little more just test to find out. So in order to test for DMD, we have to evaluate Billy's CK levels, and we have to do a genetic blood test to evaluate whether or not Billy has this disease.
How much will all of these tests cost?
So the CK level test won't be as expensive, as it normally ranges from $18 to $60. However, the genetic blood test for dystrophinopathy via the DMD gene has a base price of $650.
That's really expensive. I don't know if I will be able to afford that.
That's okay. Health insurance generally covers genetic testing when recommended by a physician, so the price will be significantly reduced. In addition, there's a couple of programs at companies such as Perk and Elmer Genomics who collaborate with organizations like Parent Project Muscular Dystrophy, which can provide free genetic testing. So there's a couple of resources for you to look into.
Okay, thank you so much, doctor.
Yeah, of course.
Good morning, Susan. I'm going to share with you the results of the genetic testing and CK level test. I found that the genetic testing showed a mutation in the dystrophin gene. The CK level test also showed abnormally high levels. Also, in your in-person visit with Billy, I noticed Gower's sign when observing the way Billy was moving, and your reported speech delay and frequent falling. This is all indicative of muscle weakness, but more specifically, a diagnosis of Duchenne muscular dystrophy, also known as DMD.
What is DMD? Like, what does this all mean? Is there a cure?
DMD is a genetic disease of muscle degeneration and weakness. Unfortunately, there's currently not a cure, and realistically, he's expected to live in his late 20s. However, there are ways we can delay his loss of muscle function and improve his quality of life through physical therapy and treatment with steroids.
So which treatments can we start with?
I can also order genetic testing for you, the mother, to assess your risk of cardiomyopathy, as that may affect development of cardiomyopathy in Billy.
What's cardiomyopathy and why do we need to check that too?
Well, since DMD is a muscle degenerative disease, it is associated with weakening cardiac or heart muscle too. Cardiomyopathy is a form of heart disease, and we need to make sure that your son is also getting proper cardiac care, especially if he seems like he's having shortness of breath and swelling in his legs.
Okay, so what are our next steps?
I'll refer to you to a cardiologist, and we can think about starting steroid treatment and physical therapy for Billy.
Okay, thank you, doctor.
Hey Susan, what's wrong?
I've been really stressed lately.
Do you want to talk about it?
Well, my son Billy, he got diagnosed with this terrible disease called Duchenne muscular dystrophy, and apparently his muscles are pretty much deteriorating, and he'll start losing mobility really soon, and the doctor said he might not even make it to his 30s. We've been going through a really tough time, and to make things worse, I honestly don't know how I could possibly pay for all his treatments and his changes in accessibility and all the expenses that have to do with that as his disease progresses. Because, I'm only working 2 minimum wage jobs. I really don't know how I'm going to make ends meet with what's going on with my son.
I'm so sorry to hear that, Susan. I can't imagine what you're going through. I know I can't do much, but I can help you look for different resources that could maybe help with the costs. We can take a look at some right now.
Honestly, that would be really great. I really do need some help.
Okay, so the Assistance Fund, Aubrey Rose Foundation, Duchenne Family Assistance Program are some programs that can help cover the medical bills and medical equipment for kids with Billy's disease. You can probably try applying for tax reductions with the IRS as well. And Able Now is also another organization that could help cover basic living expenses and transportation.
Wow, I didn't even know all these things existed. Can you send me all these links so I can try to apply for them?
Yeah, of course. I know they're not guaranteed, but at least it's a start.
Definitely.
Hi, Susan and Billy. Dr. Gutierrez told me about your case. In order to test the current state of Billy's dilated cardiomyopathy, we're going to have to run some tests. These tests include the cardiac MRI, transthoracic echocardiography, and Holter monitoring. We'll most likely be able to schedule it for next Wednesday.
So what are these tests for? Are they all essential? Money's been tight lately, and I'm not sure if our insurance will be capable of covering all of the costs.
The cardiac MRI stands for cardiac magnetic resonance imaging. Essentially, Billy will lie down on a table that slides into a large cylinder. The cylinder will use a massive magnet and radio waves so that we can get dilated images of Billy's heart on the computer. This is essential for us to examine the tissue properties of Billy's heart, assess ventricular functions, and check to see whether or not he really has cardiomyopathy. The transthoracic echocardiography uses ultrasound technology to send high-frequency sound waves through a patient's body and will bounce off the heart to create echoes, which allow us to check ventricular systolic and diastolic function, wall thickness, valve function, and if there's any presence of pericardial effusion. We just want to make sure that Billy is all right and that there's no sudden concerns. We'll also use a Holter monitor for this, and it will tell us if Billy has any life-threatening arrhythmias. Although MRIs and transthoracic echocardiographies are generally expensive, with MRIs ranging from $711 to $2,000 and a median cost of around $700 for the transthoracic echocardiogram, these two tests are typically covered by insurance based on necessity. In Billy's case, the test is necessary, so the majority of the cost will be covered. If the copay is too much, there are programs such as the Duchenne Family Assistance Program from Parent Project MD, which provides case management services to patients and caregivers who have been denied access to treatment, clinical care, equipment, and social services. They will also provide financial assistance for families in need of necessary medical equipment and travel assistance for those who travel long distances for expert care or clinical trial screenings or visits. So essentially, there are sources to help cover Billy's treatments.
Okay, thank you, doctor. I'll make sure to look more into these programs and make sure to have all of these tests done. If he does present with a more severe case of dilated cardiomyopathy, what would the treatment plan be?
There are several alternatives and combinations that could be done to treat Billy. We could proceed with a steroid approach, which would improve muscle performance and help in the preservation of motor and respiratory functions. However, it is concerning to give steroids to a young boy, and there has been evidence in animal models that steroids generally lead to worsened DMD. Dilated cardiomyopathy. In addition, some risks associated with taking steroids include delay of puberty, decrease of vertebral bone mass, increase of vertebral fragility, weight gain, cataract formation, and steroid-induced growth failure. There are also ACE inhibitors, or ARBs, where Billy could take one medication per day. In essence, ACE inhibitors prevent an enzyme from the body from producing angiotensin II, a substance which narrows down blood vessels, which can cause high blood pressure and forces the heart to work harder. So ACE inhibitors would loosen up the blood vessel and have lower blood pressure so that there's less stress in the patient's heart. ARBs are generally less effective alternatives of ACE inhibitors that are used when it is believed that the patient's body will not be able to handle the stress associated with ACE inhibitors. We can also consider beta blockers, which decreases the activity of the heart by blocking the action of hormones such as adrenaline. Some side effects may be feeling tired or dizzy, having cold fingers, difficulty sleeping, or nightmares, or feeling sick. However, this will reduce the stress of the heart and prolong muscle function. Beta blockers are also prescribed medication. Another remedy may be scoliosis surgery. Obviously, this will be an extremely invasive surgery, and with his high CK levels and the lack of dystrophin in his muscles, there's a very big risk in terms of both invasiveness from the anesthetic. This procedure, however, will most probably be able to alleviate the progression of scoliosis in Billy while preserving upper limb and respiratory function, and hopefully increases life expectancy.
Unfortunately, I don't think surgery is an option that I can afford. What do you recommend to be the best treatment plan?
Fortunately, Billy's already at the age of 14, so cardiomyopathy shouldn't have developed too extremely. We can only find out of its severity after the tests are ran. However, cardiac dysfunction in patients with DMD tends to occur later in the teenage years. By the age of 18, approximately 80% of patients with DMD experience cardiac dysfunction. I hope to be able to start Billy on ACE inhibitors as soon as possible in order to delay cardiac dysfunction. There has been a study of 28 patients with DMD where the early administration of 2 to 4 milligrams of perindopril, an ACE inhibitor, per day over the course of 3 years significantly reduced mortality after 10 years. I understand that you are worried about the cost of treatments and tests. Currently, there is an ongoing clinical trial, which I believe would be beneficial for Billy's conditions. The clinical trial investigates the use of bisoprolol fumarate, a beta blocker, in early cardiomyopathy. In this clinical trial, there's a control group where no treatment is administered and a treatment group where the volunteer would take 1.25 milligrams of bisoprolol every 24 hours. In addition to background ACE inhibitor treatment for 12 months, it is hypothesized that patients will experience preserved ejection fraction and blunt the decline in left ventricular systolic performance. Billy will not know which treatment group he gets placed into, and he will undergo treatment for about 12 months. Every 8 weeks, there will be an outpatient clinic or video visit checking on the patient's cardiac symptoms, heart rate, blood pressure, and ECG. Clinical trials tend to be free, and in some cases, you do have to pay. This will most likely, in some cases, the clinical trials will actually pay you. This will most likely help you alleviate some of the costs of the testing as they test cardiac MR and echocardiography. In addition, it may alleviate some costs for treatments and has the potential to preserve cardiac muscle health and delay cardiac dysfunction, which I think would be a really good opportunity for Billy and your family considering your circumstances.
Okay, thank you so much, doctor. I'll probably need some time to think about our options in the clinical trial.
Yes, of course. Please let me know if there's anything else I can help you with.